Everyone, I'm Dr. Lisa Larkin. I'm at my office today and I'm doing Facebook Live to talk to you about an update on the COVID situation. And as I've said in previous video posts and online, this is rapidly evolving, as everybody knows, and changing day to day. So I thought before I take your questions, because I've gotten a bunch of questions in the last 24 hours that I'll answer today as well, I'd kind of give you a quick rundown of the last 24 hours, hoping that this might be helpful. So I'm going to go through categories. So if we just talk about what's going on globally, there's been a bunch of things happen today. One is that the US-Canadian border has been closed. In the UK, they have now shut down all schools. Interestingly, just recently, the World Health Organization just came out with this discussion about ibuprofen, Advil, and the coronavirus. This is still really controversial, but the WHO really did come out today and recommend not using ibuprofen right now and using Tylenol instead for fever or flu-like symptoms. There was news out of China today about drug development and some data about one of their medications, Avigin, that it looks like in small studies in China is very effective, and it looks like the pipeline is really developing very quickly in that, although that's certainly not available yet, but good news that things are coming. And then the other big highlight kind of that's been out in the media now is about hypertension as a risk factor for more serious COVID infections. And actually some of the data is suggesting that it's not the hypertension itself, but it's actually the Ace inhibitors. This is pretty interesting to me. I don't think there's a lot of data yet, and it's hard to make recommendations about what patients should do with their medications if they take an Ace inhibitor. So this is a medication like lisinopril. But it looks like what the Ace inhibitors may do is it increases an enzyme that the COVID virus binds to. And so it can increase the rate of infection with COVID. And again, this is really poorly understood yet, but some interesting preliminary information about this. So something to pay attention for more information. Okay, if we look at numbers, where are things at? So this is really important to think about. So the total cases across the globe are now up to 214,000, and that's up to more than 25,000 from yesterday. One of the concerning things to me is what's happening in Italy. So today, 35,700 cases, and that's up 7,800 cases in the last 24 hours, which is more than double than yesterday. So the rate is still really increasing, and this is what we're worried about in the United States as well, in terms of, and what we're doing with social distancing. In the US, we're up over 7,300 cases now, which is up 3,700 cases from yesterday. And again, if you look at day-to-day increases, this is continuing to increase at a rate. And again, this is why we are doing everything we can when it comes to social distancing. So when it comes to social distancing, what is the concern, right? So we definitely have to slow the rate of infection and kind of flatten that curve. Everybody's heard that term multiple times now. But again, I just want to go through the numbers because I heard some other numbers today that are concerning. The numbers that I have really seen around the most impress is about, so if we think that between 20 and 40% of the population will be infected, and then we look at the number of those patients that would need to be hospitalized through this pandemic, we're looking at about 4.8 million individuals. And we think based on percentages, that's 1.9 million people who will need ICU care. I've seen other numbers today that's up to 4 million. So again, this 1.9 million to 4 million, we only have 535,000 hospital beds across the US and about 100,000 ICU beds. So you can see there's a huge disconnect between potential need and the numbers that we're talking about. Again, when we think about ventilators, we're looking at the low end of about 960,000 patients needing ventilators. We have about 161,000 ventilators in the US, and that's including the older ventilators. So again, there's this huge disconnect in numbers. And I really want to point out to anyone that's listening, this is why this social distancing is so important. I was really concerned last night when I was watching CNN at looking at what's happening in San Francisco, frankly. So the newspaper yesterday in San Francisco was that everybody should stay home. Then looking at kind of what's going on, everybody's out and about acting like things are normal, and things certainly are not normal. Now, I don't know if you listen to Sanjay Gupta, very often, but he is a pretty calm, measured guy. And last night on CNN, it was the first time I actually heard him really being pretty aggressive, saying this is just really not acceptable, that people are not taking this seriously enough, and that this is really all of our responsibility to delay the spread, and we all ought to be doing everything we can to do social distancing. This morning, I learned in Florida, again, if you look at what's happening with the beaches and spring break in Miami, the beaches are full. The governor of Florida did not decide to kind of close the beaches, which personally I think is a mistake, again, for the same reason that Sanjay Gupta was talking about what's going on in Florida. Again, we need to set the stage for the public that this really needs to be taken very seriously. We are going to overwhelm our healthcare system, and people will die if we don't have enough ICU beds and hospital beds, and we all need to take this responsibly. Okay, so what's happening in Ohio? We're up to 88 cases in Ohio. What's interesting, again, is what we've seen out of the global data is that there's a slight male predominance. We don't really understand why. Actually, with the Ace Inhibitor hypertension data, I wonder if that's been looked at. It's about, of the 88, it was in the 50s for male and the 30s for women. Again, not really understanding that. Interestingly, the average age is 48, so midlife, not really old people. We've had no deaths yet, which is great. But again, the numbers are going up. I just spent an hour listening to Governor DeWine's presentation. And again, one of the take-home messages from him was we really need to be mindful about who we're testing. And I really encourage everyone to listen to this as well about the social distancing, equally as important, which is that although testing is available, and I'm going to talk a little bit about what's going on in Cincinnati and where testing sites are available, testing is becoming more available. But the belief really is we are still going to have a national shortage of testing, and that we really are not going to be able to test everyone that's asymptomatic, and that we really need to be reserving testing for people who have symptoms, who have a risk factor, who are elderly, and who are healthcare workers and people on the front lines, because we should not be testing everyone for anyone that has symptoms in the same way we wouldn't be testing everyone with symptoms who have influenza. So again, I encourage all of you who are worried about being positive to not have the sense that you need to be tested. Everyone does not need to be tested, and we really should, again, it's our civic duty to be thoughtful about who should get testing. One of the other things that Governor DeWine did was close all non-essential things like the Motor Vehicle Bureau offices and nail salons and hair salons. So again, just working harder to extend what we're doing in terms of making it more of a priority to have social distancing. So again, to have decrease all our efforts to decreasing the spread. Okay, Cincinnati quickly. So what's happening in Cincinnati? So the good news is there are more testing sites available. All of the health systems have been working incredibly hard to get things up and running. So as of yesterday, both Christ and UC had one kind of outpatient testing facility that's expanding. So Christ later this week plans to be opening a second, as does UC. TriHealth now has, they're using their outpatient centers differently. So it's not a tented facility or a drive-through facility, but there are ways that patients can get tested at TriHealth. Now, as part of the practice, again, because I'm a small independent practice, and kind of who should be tested and where testing should be done has evolved and continues to evolve. My staff today, we made calls to all of the health systems to kind of get a better understanding of if we could send our patients to these other places for testing. It's a little bit in flux. Yesterday, when UC launched their tented testing center, I can tell you very quickly that they were really, really busy. And again, doing their best to accommodate everyone that they could, but they had more calls and more needs than they were able to accommodate. And so now, again, everyone's looking at how to really accommodate the demand while still being thoughtful to the fact that only people who are high risk really should be tested. So at this moment, it still is relatively difficult for us as an independent practice to hand a patient a requisition for testing, because remember, only patients with a requisition from a physician's office or provider can get the test. You can't just show up and get a test without a doctor's order. There are ways that we apparently can print a test, schedule an appointment at one of these outpatient testing centers. and have a patient of ours tested, but right now it's still kind of cumbersome. I hope that it will improve over the next couple days. At this moment, just as I've been saying for patients in my practice, please call us in the office. We are screening people with a telehealth visit. We will decide based on your specific circumstances and your symptoms whether or not we'll have you come to the office here for testing, or whether or not we will have you seen at one of these outpatient sites through one of the hospital systems with an order. And I expect honestly that that's going to change in the next coming days, because ideally we will have all patients that need to be testing done at these outpatient sites, and I will no longer be having my staff or doing the testing here. But again, I'm not completely shutting that down yet, just to make sure that the patients that really are at high risk that need to be tested, we're still doing testing. They're at least able to get it, because it's not really easily available yet in our city. Now, I want to talk just briefly about our office policy and procedures and what we're doing here. First of all, again, as I've said in previous videos, we've really cut staff back. We're now going to have only one provider in the office doing sick visits every day, and one provider at home who's doing telehealth visits every day. And we're going to see how that goes, at least for the next short period of time. We really are limiting access to the office. We only want one patient here at a time. And so we don't want any patient showing up here at the office unannounced. Please call us. We will schedule you. We have a segregated space for anyone that has flu-like symptoms. We have segregated space for people that have urgent issues that do not require a segregated space. We're really trying to do our best to keep things sterile, clean, free of COVID, but it's not perfect, frankly. We know that people, all of us, can be shedding virus days before we have symptoms. And so again, we're doing our absolute best we can, but this is the reason that we are not having anyone for routine visits coming to the office at all. We're either rescheduling those or doing those via telehealth until really the situation changes. So any routine stuff, we don't want you to come to the office. And again, we really want to talk to you before you come to the office, schedule you, and make sure that you have an appropriate need for coming to the office. Because again, we don't want to subject you to undue exposure. We really want to be part of helping decrease the spread of this epidemic as opposed to adding to it. The other thing that's come to our attention is that many patients are looking quickly for help. We have changed our policy in terms of accepting new direct primary care patients. We are going to accept new patients into our practice. We don't really feel comfortable as a practice and our providers doing just one-off visits. We don't think that's the best medical care for you. We would like to have you as an established patient, and what that means is, for that initial visit, even if you're sick, we really want to take the time to make sure we develop a full medical record for you so that we can provide good care. We don't want to miss anything. So again, if you have an urgent need and you're interested in becoming a patient in our direct primary care practice, please call and we'll kind of work through the steps for you of how to go about doing that. Okay, so I think I'm going to jump to questions, and I will tell you I had tons and tons of questions come in yesterday, which I'm going to go through a bunch, and then I'll take the ones that are coming in online right now. So some of the questions have come up about coming back from Europe, 4 or 6 weeks ago. I know it's come to the attention that people who've recently been in Europe and who've come back have to do self-quarantining for 14 days. The question has come up, what if you were in Europe 4 or 5 weeks ago? So really the situation is this, which is if you are beyond 14 days from travel abroad, you've missed, you're beyond the incubation period of the virus, and we would presume that you did not get exposed or contract the virus while you were in Europe. Now, again, that doesn't mean that you haven't been exposed in the United States, but again, the mandate for the 14-day quarantine is really 14 days quarantine from when you were in Europe last, or when you were in a country where there was a high rate of exposure. So again, for those people who've been back 4 or 5 weeks, you're beyond the 2 weeks, and I would treat you like I would treat anyone else who's walking around Cincinnati. I mentioned the Advil situation. Again, although the WHO came out today really saying use Tylenol if you're sick, not Advil, there's lots of chatter going back and forth in the media about the fact that there's not enough data. They can't really confirm that. It's hard for me to really say one way or the other. I guess in a perfect scenario, since it's easy to take Tylenol instead of Advil, I probably would do that. I mentioned briefly about the Ace inhibitors and hypertension. Again, early data. I'm not right now telling patients to stop their Ace inhibitors. I really think more data will come in the coming days to weeks. Again, control of blood pressure is important. I don't have enough information to tell you to stop, but I think there's some interesting data coming in that regard. In terms of testing, remember, again, Governor DeWine just really talked today again about if you're having no symptoms, we should not be testing you. We should not be testing everyone right now because we do not have enough testing. I understand that we are trying to get more data points about what the prevalence is here in Cincinnati, here in Ohio, across the United States. The truth is, we know it's here. We know the numbers are higher than we are aware of. Testing really isn't going to help us contain it because we need to practice social distancing, all of us, regardless of if we know that we're positive or not. So again, if you're asymptomatic, you do not need testing. If you are having symptoms, please call us. And again, not even everyone with symptoms should be tested at this point. We really want to test the people who need the testing the most. So please call us and we'll do a telehealth visit with you. I had a question about whether or not you have a hospital employee who works at home and what they should be doing. So again, my husband and I are both healthcare workers. We clearly are exposed. My husband, as emergency room physician, is certainly at much higher risk than I am, although he has the full PPE that I don't have. So maybe we're both equally at risk. What I am certainly doing in the office now, and what I've told my staff, is we are all wearing only clothes that can be washed in the washing machine as soon as we get home. We are all taking our clothes off when we get home. We are washing our clothes at home, quick showering before interacting with our family at home. And that's what everyone should be doing. In the office, we are doing everything we can to take precautions, again, with gowns that we have available and patients and providers wearing gloves and hand washing. And again, what we're doing with segregating patients, segregating rooms, only having one patient here at a time. But again, nothing is really perfect. Carry-out concerns. So I've had lots of questions about whether or not carry-out food is a concern because of hospital workers actually touching the food. Certainly, here's the thing, which is that when people touch the food and the food is cooked, that obviously then disables the coronavirus. You are correct. If people have not adequately washed their hands and as they're putting food into containers to put in bags to send out, there's always a slight risk, just like there is with hepatitis A. But again, the goal now is, and I hope that every single food, restaurant or a place that is making food to send carry out, that all of the employees are washing their hands very, very, very frequently. And again, it's not perfect, but I think again, it's better and lowers the risk than being in big restaurant situations. What about walking outside? So that is what I think we all should be doing, and hopefully the weather continues to improve. Not in groups, social distancing, be at the park. We shouldn't be in big clusters. But again, we all do need to get outside and get exercise. And again, I would be doing that with your immediate family, people that you're at home with, limiting contact with friends and other people and groups, and really, again, practicing social distancing. There was a question about when we'll see expansion of testing to people who are not sick. And again, I was more optimistic that in the coming days and weeks, we would have the availability to test large numbers of people, even if you're not sick, because we do know that viral shedding happens in the days prior to developing symptoms. But at least in listening to Governor DeWine's news conference today, it sounds like I'm less optimistic about now than I was. But again, we'll have to see how that evolves over the coming days. I had a question about adult children who are currently working in other cities who now have been furloughed to work at home and who are sitting in apartments in other cities and who want to come back to Cincinnati or to their family. This actually is my case with my son, who's an adult who lives in Chicago. So is it okay for him to come home now back to our house and work remotely so that he's around family here? The truth is it's not perfect. So he's been exposed to lots of other people in Chicago that I haven't been exposed to. Now, again, I'm a healthcare worker, so I'm getting exposed to lots of people as well. my recommendation would be if he was coming home, I would prefer he drove rather than take a flight because, again, of all of the closed environment concerns with airplane travel right now. But again, although the risk is not perfect, if he's not symptomatic, I am going to let him come home. And again, it's not perfect, but as long as he's not having symptoms, I'm going to presume that he's not infected and go from there. Okay, now I'm going to take your questions. Let's see who's got them here. Your live questions. I hear that the tests are taking 10 days to get back. Have you heard that? Okay, so this is something else. I'm glad you brought this up. Here's the thing. I just heard today on Governor DeWine's presentation, and this is very interesting to me. So as you may know, I, as a small practice here in Cincinnati, have been doing tests now since last Thursday. And again, I've done very few of them. I'm up to now 6 tests since last Thursday in very select people. I am not testing everybody. I don't think we should be testing everyone, but LabCorp, a national lab, has testing available. And so I have been doing nasal swabs on high-risk people, sending them to LabCorp, and the turnaround time for me has been 3 to 4 days. And I have been getting test results back. So the ones I sent Thursday and Friday, I have test results back. The ones I've sent this week, I do not have test results back yet. Now, again, I am not doing mass testing. And again, I think where testing is done is going to change in the coming days. What I just heard today in the press conference, which is very interesting, is my understanding that the health systems right now here in Cincinnati, when they're doing the mobile drive-through testing, right now they are also sending their swabs to LabCorp, which does mean a 3 to 5 day turnaround. I understand now, again, just learned this today, that in the state of Ohio, through the public health system, that for patients who are really critically ill, where there's a need to have very rapid turnaround, that the samples can be sent there and that there is capability here within the state to do more rapid turnaround. I am not aware how that's done. I assume that this is from the hospitals, that there's a different pipeline for sending samples there for the people that really need urgent testing. But again, as far as I'm aware, what's happening right now is that at least here locally, most, if not all, of the testing is being sent to LabCorp, and there is a delay in the turnaround. And again, this is really confusing right now. I've been really trying to understand this and learn as much as I can. And I think what I just told you may be very different tomorrow. So stay tuned. Okay, other questions. Is there evidence that the virus will go away with the warmer weather like the flu? Okay, wouldn't we all like to believe that? I certainly would, right? My daughter's scheduled to get married June 4th in Santorini, Greece, and I am increasingly pessimistic that that wedding will take place in Greece as planned with all of this. The hope has been that as the warmer weather, comes, that we would see seasonality like we do for influenza. I think that that is very unclear now, and I do not think that we know in any way, shape, or form that the warmer weather is going to help with this. If we look at the data from China, my sense is, again, that the peak and really the slow, kind of we hit the top and we're coming down, it really took about 4 months. And I believe that this is where, the statement from President Trump yesterday on the news brief was really setting a different expectation for all of us, that this really may continue until July or August, and again, beyond the warmer weather. So I do think for all of us who wish that the summer was going to be very different than what we're seeing right now, I'm not really sure that that's the case. Okay, another question. How long does the virus survive on surfaces like grocery carts and Amazon boxes? Okay, I am not 100%. I can't give you specific times. This is the little bit of information that I know. That hard surfaces, it appears to stay on, it can be several days. On cardboard and other surfaces, not as long. Now, what does that mean? It means that it can be there. We're not all perfectly sanitizing every single hard surface that we're coming in contact with. And this is why washing your hands should be the absolute priority as much as you possibly can frequently. And my hands, frankly, are raw at this point. And that again, it's hand washing in case you've touched anything and not touching your face and your mouth. And that's more important than anything. And again, after you've come in contact with a new hard surface, again, what we're doing in the practice is patients that come in, they are putting a mask on, they are washing their hands with soap and water in our office. Staff is washing their hands with soap and water in our office. And then when the patient leaves, we're washing our hands again, and the patient is washing their hands again. So again, we are, anything that you've come in contact with, you can continue to wash your hands. And is there a prediction for when the peak will hit and the numbers will start to diminish again? I think it is just all over the map, but best I can say is July and August is what we're thinking right now. And that honestly can be completely wrong. Right, so another one, the governor just said that manufacturing companies need to take all employee temperatures every time they walk through the door. Great idea, but what kind of thermometers would you recommend? So right, I listened to that the governor said as well. This is really something that I believe they did very effectively in China and in South Korea, and is really one measure that they found effective for identifying people who were developing symptoms, who were at risk, that didn't realize that they were sick. The difference is in those countries, those patients were then taken to specific areas to be tested and quarantined very immediately, and we don't exactly have that system. So the problem is here, even if we identify someone who has a fever who's walking into a building, we're sending them home to their family. It's not exactly the same quarantine process as we had in other countries. So I'm not sure that the impact is going to be the same here, even though Governor DeWine is suggesting that. And I understand, of course, why he's suggesting that. We need to identify people who are sick. But the question really was, what are we using to take temperatures? He didn't make a recommendation. I predict right this minute there's a run on thermometers on Amazon.com, and ones that you can take the temperature in the ear and mouth and forehead. And I don't really have any ideas of what's going to be recommended right now. So that was a terrible answer to a good question. All right, I have another question. If someone like me has asthma, how do we know if we have it? If, say, my asthma is flaring up, how do I know if it's just my asthma or the virus? So that's a really important thing, that, if you are having a change in your peak flow, any new symptoms, you're using your inhaler more, anything that you think is different, that warrants calling your primary care provider and letting us talk you through. Again, generally now it's fever and myalgias and achiness and flu-like symptoms, but not always. And so you are correct. If you are having an asthma exacerbation that you can't explain any other way, you haven't had a recent cold, I would be suspicious and I would want to hear from you. And again, the typical process would be, if you're not very sick, you're at home, you call, you don't have a fever, your asthma is mildly flared, we would talk through how to kind of manage that for the next 24 hours. My hope would be we would talk to you the next day, see if you've kind of turned the corner, whether or not your symptoms have gotten worse, whether or not, again, at that point, we need to shift gears and decide, do you need testing? Do you need to be seen? Do you need to be seen in the office? Do you need to be seen in the ER? And how we would kind of triage you. So again, anything that's a change in symptoms, particularly if you're a person with, an underlying illness like asthma, please, any change in your health, please call the office so we can talk to you. And then, should we cancel a flight next week? Will flights be canceled for all soon? All right, so there is no mandated global travel ban in the United States right now. But I would tell you, my personal opinion is no one should be going on commercial flights right now, even in the United States. And that's a very hard thing to say. My son has called me and said, are you sure I can't fly to see my sister? I mean, I can't tell him. He's an adult. He's going to do what he's going to do. But my personal belief is that we all have a civic duty and social responsibility to do social distancing right now. And the numbers I told you are terrifying. If we really let this peak happen very quickly, our health system will be inundated and people will die. We will not have enough hospital beds or ICU beds and this will be bad. And so I believe that we all really need to be doing everything we can. I know it's a huge inconvenience. Driving is, if you have that option, a better option. If there's a particular emergency reason that you have to travel on an airplane, of course you're going to have to do it. But my bias is I wouldn't be traveling commercially now. All of my professional conferences have been canceled. All of my speaking engagements, all of everything for me has been traveled now, canceled all the way through May. Nothing. I mean, I've probably had 10 things canceled within the United States. And, I think we shouldn't be traveling commercially. Now, I know that all of the airlines continue to cut flights. I don't know if everything will be shut down completely or not, probably not completely, but I expect very, very limited commercial flights will be happening. Okay, and I've rambled on for a really long time today. I'm happy to take any more questions if you have them. Otherwise, I will plan to do another Facebook Live tomorrow at either 2 or 3, depending on if Governor DeWine is going to have another 2 o'clock press conference, because I don't want people to miss that. Friday, I am really hoping to have one of my colleagues from Cleveland, who is a psychologist, a mental health professional, doing a joint Facebook Live to talk about just stress management during this time, because I can tell you, I think we are all feeling it. I certainly know I'm feeling it. And I think the reason we're feeling it is because the end of this is really, really uncertain. I think if we all knew exactly when we would go back to our normal lives, this would be easier. I remember when I was pregnant and had terrible morning sickness, and you think it's just never going to end. And it's really depressing when it's never going to end. And then it ends and you feel better. But I think having some sense of when this was going to be over is going to help, and we don't have this now. So I really, her name's Dr. Cheryl Kingsburg, and she's fabulous. And I'm hoping she'll be on Friday. Again, I'm not sure if that will be at 2 or 3 o'clock, but stay tuned and follow social media. Thank you. Stay safe, everybody.